Hi, I'm Dr. Alexandria de Lima. I'm a veterinarian who practices equine medicine. Currently, I'm actually doing a Master's of Veterinary Science at the University of Putra, Malaysia that is focused on equine medicine. I'm also back in Sri Lanka and I just started my own equine veterinary practice called Horse Care Equine Veterinary Services. So I kind of also have a Facebook and Instagram page where I do share what I do and essentially interesting information in horse medicine.
So how did you begin your career in veterinary medicine, and who and what inspired you most in this field?
Okay, so how you started is essentially okay. So when I was about 7, 8 years old, actually we went on our first trip to Yadla National Park. So kind of before I went into the park, I was kind of like reading up on all the animals that are there and like doing a little reading and research type of thing. So then when I went there, like I was talking with the tracker and like he was very impressed with how much interest I had shown in it. So he was like, oh, maybe you should consider this as a field. And the idea kind of just implanted in my head that, oh, I should do veterinary medicine because it's fun. So it kind of was like a lifelong passion to become this. So of course, then you have to go through school, do your studies, pass A levels, unfortunately, which is it's not an easy thing for anybody, but like, you kind of have to because that's a requirement for veterinary medicine in universities. And then I started, of course, applying to certain universities. Majority of the universities are actually very expensive and very difficult for especially as Sri Lankans to afford to go abroad and study. But I found Malaysia to be relatively affordable. So I joined the University Putra, Malaysia, and yeah, so the cost of the education was essentially 1/10 of the UK place. And like even cost of living was not so bad, and the culture, it wasn't much of a shock because they had a very Asian culture just like the way we do. So it was very easy to meld in. And yeah, so then it was 5 years of a degree, very hard 5 years of a degree, because it's a lot of long nights, a lot of late night studying, but you just kind of have, I'm not a fan of saying push through it, but you kind of have to give it your best. And yeah, so once you pass, you kind of come out the other side not thinking like, oh, okay, now I'm a doctor, now what do I do? Yeah, so like a lot of imposter syndrome the first couple of years as you come out, but yeah, but then like once you're out, you have to join places and you have to follow other vets to actually learn how to handle the situation, because what you learn in university is not really the practical real life situation sometimes. So I was lucky when I first joined Pet Vet Clinic that I actually had a lot of good mentors that guided and taught me a lot of things. So it was not just the clinical skills that I had learned and the medicine side of things, but also like client communication, handling bad situations, because in the place that I joined was an emergency veterinary hospital as well. So we get a lot of cases where patients are, about to pass. So you have to be able to handle that tense situation as long as being compassionate towards the owner. So yeah, so I had Dr. Nalanika and Dr. Dayani, who were absolutely great as mentors, and yeah, they were just amazing. So that was in the small animal section, but I always had a thing to do large animals. So Pet Vet was very nice enough to offer me an opportunity to do equine as well through Pet Vet, and they were help with the sponsoring of all the equipment, and it's not a cheap thing to start up a practice. So yeah, they were very nice that way, and Dr. Nalanika actually introduced me to a Thai vet who did the very same thing that what I was trying to do, was to develop a proper equine practice in her country. So she essentially taught me the tips and tricks of how to do it here. So it's almost the same applicable. It's the same situation in all countries when it comes to like owners and the situations. So her relatable experiences was kind of things that I could, put into practice. So it was not that I was starting from zero. I did have a base to kind of start off from. So she was Dr. Siraya Chunakamrai. And yeah, so she's still very helpful even now. Like I still message her about things, and she's very helpful to help me with cases. Yeah. So those were my inspirational people that gave me the confidence and the go forward mentality about being in vet med.
Working alongside animals, horses and equestrians, what has it been like and what were some of your best experiences?
Um, well, of course, working with animals is the primary goal, and everyone joins veterinary medicine thinking that, oh, it's just going to be with animals only. But unfortunately, you learn the bitter truth afterwards that, oh, actually, it's about 80% is more dealing with the owners than it is to dealing with the animals, because that's the easy part. The other side is a little more difficult. But like, there of course it's a very varied, because that each of them have their own personalities and their own mannerisms, so you kind of have to adopt your approach to each of them very uniquely, because you can't all of them won't handle the same approach, and you kind of have to be calm and very respectful even around them, because a lot of them aren't used to getting handled in the ways that we have to handle them, so you kind of have to take it slow. So with equestrians, even like I'm appreciative of my time with them is mostly because um, we I can't say that I know everything about anything, and even with horses or even with dogs and cats, even though I've been in the industry for so long, you can't claim to know everything, because there's still so much to learn. And even though we go through a degree and all that, there's so much more that you can learn from other people as well, and I'm always open to it. So I always love to hear other people's experiences and what they go through, so that I can learn to either incorporate it into my work or to either educate them to maybe think of different ways. So it's a good experience to have with them. So one of my best experiences in terms of veterinary medicine overall, I would say, is like I do love even though I'm terrified, I do love doing surgeries. So like especially with dogs and cats, that's one of those things that there's a little bit of adrenaline rush going through when you do it, and it's a very satisfying process, especially if it comes right, because it's like okay, it's going to come out the other side well. And especially when it comes to horses, we do a lot of routine castration. So we do it under general anesthesia, which is actually quite scary and risky, because you drop a big horse down. But we like when I used to work with pet vet, we used to have a team of veterinarians as well. So we had someone actually monitoring the anesthesia to make sure that they're stable, and then they keep topping up the doses as we need. And yeah, so we have to do it in like under 15 minutes, which is, even though you think, oh, 15 minutes seems like a long time, but when you're down there, it doesn't feel like, time just passes very fast. So you have to be very quick about it. And then so it's like you have to be mentally prepared for every stage of the thing. Yeah, so that's like the thing that kind of like keeps me going and gets me very excited about it.
Tell us some common errors horse owners make when taking care of their horses.
So I think especially as a vet, one of the most common things that I would find is either ignoring the problem so much that it becomes worse, or trying to treat the problem yourselves and then it becoming worse. So what I would always recommend is essentially at least call and get the vet's opinion on a case, and before you go embark on it, so that at least you have some level of guidance as to how to manage the condition, and at least if anything goes wrong, the vet is aware that this can happen, and they're prepared for it, rather than getting a call at 9 o'clock in the night to come out for a case is not really the most fun. So we do prefer to like kind of like do things during the day. So it's essentially like kind of being proactive about issues that come up and not ignoring them till it gets bad. I think that's the main thing that I would come across here.
What makes a good veterinarian and what skills do you feel good veterinarians should have?
Okay, so what would make a good veterinarian? Okay, so a good veterinarian, I mean, apart from the obvious things of having good clinical skills, diagnosing, treating, those are like the very basic and most obvious things that a vet should have. But in my personal opinion and in my personal experience as well, more than anything, you should actually have good client communication and empathy. Because when owners bring their pets to you, even with the horses or dogs, they're very concerned and overly concerned about their animals, and they do get worried. It's like most of them are their children, and that's their family members. So a lot of people do forget that when it comes to treating veterinary medicine. I mean, I'd understand at times because it does get busy and we don't have the time for it all the time, but we kind of have to understand that they are coming to us because they want the assurance that, oh, you know, everything's okay with their pet and everything's going to be fine. So for me, it's, you can be like the most skilled surgeon or you can be the best diagnostician in the world, but it doesn't really matter at the end of the day if you can't speak to your clients well and you can't offer them the comfort that they need at the end of the day. And it's also being very gentle and loving towards animals, because a lot of people are very rough. They can get very rough and they can get, which essentially scares them and makes visit unpleasant. So taking your time with them, you know, making it fun, throwing them treats sometimes is really a ways to kind of like keep it going. So it's just essentially a lot of empathy and love towards the cases that you come across here.
What procedure and qualifications are necessary for students to pursue, especially in Sri Lanka,
Okay.
the specialized field of equine medicine?
Hi! Right, so to specialize in equine medicine, first and foremost you do need a veterinary degree. So there are options available all over. You kind of get what you call the Doctor of Veterinary Medicine, which is a DVM degree. And it's a master's level type of course, so you actually get a double, it's almost like a double degree. Then you get the Bachelor of Veterinary Science, which is a general bachelor's, but even if you do both, either one, you kind of still come out and graduate as a doctor of veterinary. You do get the license to practice. So the option of going to where you want to go is essentially very personal and depends on what you can do and where you can go. And it's actually a very, very competitive field to get into, so that, I mean, it's one of the most competitive fields because there's only so few veterinary colleges in the worldwide, so like everyone tries to apply to every place. So you kind of do have to be the very best of the best to kind of go into it. So most of them do get in with just A-level courses, and many of them, like especially like the Australian universities, they don't even look at A's anymore, you have to get A stars. So yeah, that's how competitive it gets. But a second route that you can do is essentially like do a diploma of animal science or some relevant field that is essentially related to science and animals. Those are your options. So once you finish your veterinary degree, which takes about 4 to 5 years, or even 6 years in some places, then you come out and you essentially are a doctor, but you are still considered as a general practitioner. And I mean, you can specialize, but be a general practitioner in different fields. You can do small animal, you can do emergency, equine, large cattle, dairy, like livestock as well. And you can still, you essentially do consider yourself as to be a specialization, not really a specialization, but you can be an expert in that field with just your basic degree, just because of your intuition to learn and to improve on it. However, if you do want the title of being a specialized or board certified veterinarian in a particular field, you have to essentially go through further courses. So first you need to do an internship, which takes about a year, and the internship has to do with the field you're trying to get into. So it's essentially like, if you want to do equine, there's equine surgery, and then there's equine internal medicine, then there's equine reproduction, neonatal medicine. So it's divided up a lot. And then afterwards, after the internship, you have to do like a 4 to 5 year residency course. So that is essentially where you do become specialized. So once you complete the course, you have to do the exams at the end of the day, end of your 4 years, which is a big, massive exam. So only if you pass that can you consider yourself as a equine veterinary specialist. And essentially once you get through that, it's doors are open for you all over the world, because it's a very competitive, because each course or each university that does it, they take only about 3 to 4 people per year. So it's very difficult to get into, and so that's why a lot of people, many people who can't get into it just continue as general practitioners. But because you can join shorter courses which take maybe about a week or so, or 3 months, where you can kind of like do courses where you learn certain skills to employ into your practice. And because you keep practicing, you get, I mean, practice makes you perfect, right? You essentially do develop into a place where you can be of a level of a proper specialist, but you just can't use that title. Yeah.
Can you suggest areas you would like to see improved in the field of equine medicine or veterinary medicine in Sri Lanka?
Okay, so if you're looking into for equine medicine, one of the main things that we would actually have to improve on is first is our number of vets that are who do equine medicine. I mean, worldwide over, there is anyway maybe less than 5% of the crowd actually join in equine medicine because it's very hard, it's very difficult, which is very fair. And it doesn't necessarily, it's not a very high paying job, especially as a general practitioner, because hours are long and it's extraordinarily tiring. So a lot of them may not always go into equine medicine. So even here, it's like less than a handful that actually come out and practice equine medicine. So one thing would be is like to have more opportunities for equine vets to, at least for generally vets, to practice equine medicine so that they are able to provide the services, because even for me alone, even though I can do what I have to do, I can't be in all places at once. And Sri Lanka, even though we are a tiny island, is still a very big place to travel through. And then not all horses are kept and maintained in Colombo. So like to travel all the way to either Dambulla, Anuradhapura, Diyatalava, it takes a long time and it's not always the practical solution. So if you have more vets coming out who like to practice equine medicine, that would be the first solution, because then, you know, at least all the horses in the country will be covered. The other issue would be to at least, even if you're not a person who's going specifically into equine medicine, but to at least have the basic knowledge to treat horses, so that if an animal is in distress and you're the only one there, you have at least, you know, a general understanding to treat the particular animal in front of you. Because we have a lot of government vets who do go out to treat, but they are stuck because they don't have the resources to actually, you know, be able to treat. But like in my experience, especially now, like a lot of people have been reaching out and asking even me to kind of like help them with what they want, what is needed to get done, and like treatment wise and what medication to be given. So it's good that they're reaching out as opposed to trying to, you know, do it themselves. So because then it's a sharing of knowledge, because I'm very open to, you know, essentially giving out everything that I know, because that's the only way that you're going to go forward. Yeah, so it's a matter of, you know, having proper equine courses, and or even taking part in what we call continuing education courses. So there are a lot of free courses online that have veterinary, like equine medicine related content that is relevant to what we even see here, even though it's from other countries. Yeah.
What advice would you give to anyone who wants to pursue a career in equine medicine?
Okay. So if you're pursuing a career in equine medicine, or even in veterinary medicine alone, is to make sure you think long and hard and make sure you understand all aspects of what it takes to be a veterinarian or in veterinary medicine. One of the ways you can do that is volunteer at a veterinary clinic or assist with any type of rescues and animal shelters, just to kind of have your eyes open into what the industry is like. Because one of the things is the coursework is not easy at all. It requires a lot of effort from your part, and it's essentially giving up majority of your very young adult life. So there's almost very little social life when you go through it. I mean, if you are able to balance, great, but not everyone can. The other thing is, in global statistics in terms of veterinarians, they actually have one of the highest suicide rates in the world, which is almost 40%. And of not the ones who are surviving, almost 50% of them do leave after 5 to 10 years of their career, because it's just that it takes a toll on your mental health. So there's a lot of specific, not specific, but like you see it a lot in the veterinarians, is like we get burnout, compassion fatigue, which essentially is because we try to go overboard and try to do so much, because we do love where we are. We essentially sacrifice so much of ourselves and our personal lives to be doing what we are doing. But it does take a toll on you, and not a lot of people can handle. I mean, it's not that they can't handle, it's just that we don't always get the support we need to push through and, you know, keep going. So just make sure that you are mentally prepared, and you are, even though you are aware of the problems, you have coping mechanisms that kind of keep you safe and sane. The main thing is that you do really have to love animals and want to work with them for you to actually want to essentially to drive you through into this field, because with all its hardships, those they are the ones that kind of keep you going and keep you sane.
And finally, we would like to know about your new venture, Equine Veterinary Services.
Okay, so I started Horse Care Equine Veterinary Services as an ambulatory service to kind of provide veterinary services to horses and ponies, because I noticed that there was a gap in the industry where we needed equine vets to treat horses and that. So this through the it's essentially just like running a clinic but on wheels. I can travel. For me, I'm very comfortable traveling anywhere and everywhere as long as it's within a reasonable amount, and to provide whatever services we do need. And my main goal is essentially to provide preventative veterinary health care, because that is more important than emergency treatments and saving animals. So like vaccinations, deworming, dental, making sure that I can work with farriers to ensure that the hooves are properly done, which is something that a lot of problems are here because there are not proper farriers. So those are the things that you can do to kind of like prevent problems from happening. So even to, if you're talking about even colic, one of the main things is that causes colic is improper nutrition. And when we talk about nutrition, it's just not that what are you giving, but how much are you giving, how frequently are you giving. So a lot of people aren't aware of the proper protocols to feed a horse. So essentially educating people on that. So it does require you going there and kind of seeing what is there, what the situation is like, because when you see, you can't really do it over the phone and things like that, because it doesn't necessarily mean to establish for one place. You kind of need to see the whole entire system. So it's not, we call it a holistic approach. So essentially it's not just that, oh, you only treat one aspect. You kind of look at it how the entire environment and how the entire, in the way the horses behave, the way the owners behave towards the horses, is the main way of how you would essentially create a preventative health plan. So you rather prevent than, treat a problem when it's too late. Yeah.
So thank you so much, Alexandria, for joining us today and telling us so much about equine medicine and the importance of it, and also the equine section. So from Bacardi again, thank you so much for what you're doing as well as a vet, and it was so nice for you to join us on Equine Mastery. So thank you so much.
No
I wish
worries.
you all the best.
My pleasure.